Hello, everyone. I'm Paul Kempinski, President and CEO at Children's Mercy. You know, we live in very challenging times, as you know, and one of the challenges that you are now all facing are decisions being made in terms of whether or not your children will be going back to school or not, and depending upon whether or not they will be in the classroom, how should you handle the structure of their education and the decisions that you have to make at home to be with them, supporting them, and helping them to work through this journey. We're very fortunate at Children's Mercy to have nationally known experts who are helping to work with health departments, school districts, and superintendents to provide evidence, information, and guidance onto how to ensure safe and effective return to school for our students. And we're very pleased to have some of those folks with us today, and I would like to introduce them to you in a moment. But know that Children's Mercy has been actively engaged with our entire community in helping to provide that guidance and that advice, recognizing that the ultimate decisions on whether or not your children will return to school rests with the school districts and the superintendents. But we're happy to be at the table providing that expertise and that assistance. So now I'd like to introduce three of our faculty who are very well known in their fields and have been actively involved in our COVID-19 journey here at Children's Mercy and throughout the community. First, I want to introduce Dr. Jennifer Bickel. Dr. Bickel is the medical director for our Center for Professional Well-Being and is also the chief of the headache section in our Division of Neurology here at Children's Mercy. Dr. Angela Myers is director of the section of infectious disease here at Children's Mercy, and Dr. Jennifer Watts is medical director for emergency preparedness, an emergency medicine physician, and also director of our global health program. So with that, I'd like to now turn it over to Dr. Bickel, and she will in turn turn it over to our other physicians. Thank you so much.
Thanks, Paul. It's an absolute pleasure to be able to speak with you all today. So one of the things that I wanted to talk about was making decisions during these times. My colleagues, who I trust very much, are going to be able to give you some of the facts and what we know around COVID, around our community, and around some ideas about what must be best for our kids and our families. But these are challenging times. These are big decisions to be made at any time. But right now during COVID, we're seeing different themes come up which are making these decisions even harder to make. So when I'm talking about making good decisions in difficult times, let me talk a little bit more about that. So what that means right now is that so I'm a neurologist, right? So I've spent over a decade studying the brain, working with people, and really trying to understand more about how it is that we make decisions in our best selves. I'm also the medical director of professional well-being, which means that it's part of my role to support our staff to help them to take care of kids in the best way that they possibly can. And one of the themes that we're seeing currently right now is uncertainty. We're used to having anchors. We're used to knowing certain facts, such as we always go on vacation for a week in July and we travel to the lake. Or my kids play football and that's what we do. Or this is the school we go to and this is where they go for childcare after. Or my favorite Mexican restaurant is down the street and we go there on Tuesday nights. Even if those aren't our exact routines, right? But the thing is that we're used to elements of routine. We're used to things that we can make easy decisions on. And right now, the level of uncertainty is all the way from how safe is it out there? Should I travel? Should I not? Am I a good mom for sending my kid to school? Am I a bad dad for wanting them to stay at home? What about their development? What about their mental health? What about their sports? Or what if I don't have kids, but people don't seem to understand that I'm taking care of my grandma and I'm really concerned that I might bring the virus to her? There's so many different high-level areas of uncertainty. But one of the reasons that it's even harder to make those decisions is because of the fact that we're having to make decisions on much smaller levels, decisions that typically took no cognitive energy, no energy of the brain before, are now challenging. So let's talk about dinner, right? Is it just as easy as going down to that restaurant? What is their mask policy? Do you go out to eat? Do you not go out to eat? What happens if you go out to eat and you get COVID? Will your employees, will your colleagues judge you? Will you make other people sick? Suddenly, what's an easy decision becomes much, much harder. And because of this, we are having decision fatigue. Throughout the day, it's becoming harder and harder to make decisions, even about the smaller stuff. The smaller stuff is now higher stakes than it was before. It's got more emotion associated with before, and there's also more variability. I bet you and some of your friends who typically get along are finding things that you are disagreeing on right now and how to respond and how to move through this crisis. And there's probably some emotions associated with that. And so because of this decision fatigue, people are actually just tired, right? They're tired. And they're not sure why they're tired, but they're tired. And so what this means is that during these states of decision fatigue and being tired, and this is all not to mention the other things that we're experiencing, such as a sense of grief and loss. Many of us have lost a way of life. We've lost understandings. We've lost some of our social supports. COVID has affected people on a personal level. We often talk about the domains, right? So it's not unusual, let's say, to have a change at work, but your personal health, your friends, your family, everything stays the same. So you have the resiliency to adjust to the changes at work. But what's happening right now is that the changes are affecting us personally. Is my health in danger? Is it not? Is going here risky or not? Do I have to take time off for this? Do I not? It's affecting our families. Is easy? How do we balance the childcare? What if you're a single parent? There's so many different elements there. And then our community. It's not as easy to gather before as it used to be. And so some of the easier ways that we were able to deal with stress are taken away. The other thing too is the fact that it was easier when we saw people to come to resolution and to understand other people's views, because you could sit there and actually kind of talk it through while having some dinner. And now it's becoming easier and easier to become polarized. And there's so many other elements that going on nationally, even beyond COVID, which make this even harder. So what that means is that it becomes very hard to make decisions. And there's lots of numbers, and there's lots of facts, and there's lots of opinions going around. So how do you make the decisions that are best for you and your family? One of the things to start thinking about is, who do you trust? And what do you trust? We're commonly seeing people switch to basically they look to 15 different websites and they read tons of different articles. No matter what the quality of the article is, no matter who put it out, no matter if it's their Uncle Bob or if it's the CDC, right? They're weighing it all. And so it can be exhausting to have to weigh all of those opinions. And the human brain is not supposed to have to weigh so many different variabilities. It needs something that it can trust as far as information, and it needs to not be overloaded. And so when you think about what do you trust or who do you trust, I really recommend that this is not one of those situations where you ask as many people as possible about what you should do or what their opinions are. But these are times in which you identify a few sites that could be reliable, which Dr. Myers and Dr. Watts will talk about, that high reliable sites that you can find information to help guide your decisions. And then as far as who do you trust, I have to admit, you guys, this is where I'm lucky. So I'm a physician, which of course helps to be able to interpret some of the data, but not a lot. I don't have a master's in public health. I am not an infectious disease specialist, but the truth is that I have a couple of great colleagues who are getting ready to speak to you who are. And so I trust them in part because of their expertise and because of their extensive training and because this is what they had dedicated their life to doing before COVID ever showed up. They had already decided they were passionate about this. They had already decided they cared about it. And so when they speak, I know what they're telling me is what they're able to say to the best of their abilities. And then there's also the intention. So it's not just the expertise and the knowledge. It's what is that person's intention? Is it to become famous and be quoted everywhere? Or is it to truly make an impact in our community? And so once again, this is where I'm lucky because I've known Dr. Myers and Dr. Watts for many years. We're all from Kansas City. Well, I moved here when I was 18, but I've been here for over 20 years. And so I truly care about this community, and I truly want it to succeed in the best way that we possibly can. And I know that Dr. Myers and Dr. Watts feel the same way. Dr. Myers and I met in medical school quite some time ago. I won't say how long ago, but however long ago it was just means the more experienced we are. And Dr. Watts, we met on our way to a medical outreach trip to another country, and hit it off because of the fact that we all knew that we were here to be able to make our community better and to help patients' lives. So I trust them because of their expertise, and I trust them because of their intention, and I trust their recommendations as well, and I hope that you can as well. The other thing to think about when you're making your decisions is your own personal values. This is hard. This can be really hard, but right now is when it requires for us to have as much self-reflection as possible, as much ability to realize what matters to me and what matters to my family. And this is where it becomes harder for other people to give you advice because their values might be different. Maybe somebody's values are for their kids to be able to be straight A's no matter what, and so their decisions are going to be based all along that. Or maybe your values are more the fact that you want your child to be not scared when they go to school. I don't know what it is. You know, everybody has their different scenarios and their different values, but the truth is that this can really help to guide you. What do you care about the most in a year? What do you care about the most for your family? What do you care about that you can collaborate with your family and know that if you were at least making your decisions with that intention in mind, that you could be okay with the outcome? That becomes hard, right? That becomes really hard. It's a lot easier for someone to tell you exactly what to do. But it is a lot harder to be able to reflect upon your values and what matters the most to you, but that can help to anchor you and get you through this, along with the facts and along with along with knowing who to trust. So we're pediatrics, so I love the fact that there's never a shortage of cute kid pictures or artwork. I'm sorry for anyone who does not have the opportunity to work in such an environment. But really just take this moment right now to see if you can spend some time relaxing your mind and just thinking peacefully, just calming yourself down, trying not to multitask as you're watching this, and try to see how you can listen to the doctors and what they're saying. Maybe not make decisions right away, but how can you listen to it, absorb it, and keep thinking about what are my values? Who do I trust? How do I find more information? And how does this connect to us? So thank you all. I know that you guys are eager to hear more information about how to guide your decisions within the Kansas City community that's best for your families. And so it's my pleasure to introduce Dr. Angie Myers.
Good afternoon, and thank you for inviting us to be here today. So I'm going to talk about a few topics in succession, and hopefully we'll answer some of the burning questions that I know you have and the things that have been raised in our community. So I'm going to first talk about COVID-19 infection in children and what it looks like. Then I'm going to talk a little bit about how to make decisions on school and sports for your children, the importance of testing for COVID-19, and why I personally wear a mask. And then at the end, I'll talk a little bit about the update to what's going on in the world of vaccines. So I wanted to start by giving just a little bit of an overview across the world of what COVID has looked like for children. So what we know based on data that has been submitted to the CDC from other countries and published in the literature is that in general, children have represented around 2% of infections. And it depends country to country. In Spain, it's less than 1%. But overall, worldwide, it's around 2% of infections. So relatively low numbers compared to what adults are experiencing with COVID-19. And this has been the case kind of throughout from the beginning moving forward. This data that I'm showing you right now comes from a paper out of China that was published early on in this spring. And it was really one of the very first papers that highlighted the symptoms and the disease severity of children, largely because China is where the epidemic started before it even became a pandemic. And so data came out of China first. And this was looking at over 2,000 children that the median age was 7 years, and that 94% of kids had non-severe disease. The majority of those had mild disease. About 40% had moderate disease, and then a smaller portion had severe disease, and a very, very small proportion, less than 1%, were critical. And in this study, there were very few children that had no symptoms, which is important because as you know, there's been a lot of discussion about this asymptomatic transmission and people carrying the virus but not having any symptoms. So fast forward a little bit, and in April of this year, the CDC published some data around COVID symptoms in children and adults. And what we know to be the truth is that in general, kids have milder symptoms than adults. So about half of all kids, just a little over half, will have fever, whereas over 70% of adults have fever with COVID-19. About a little over half of children will have cough, and a pretty small percentage will have shortness of breath as compared to adults. And if you look on down, in general, kids at a lower frequency have symptoms, and when they do, they're more mild. So this particular data from the CDC looks at hospitalizations in children, and what we know to be true is that children under the age of 1 are more likely to be hospitalized than older kids. And some of that is because, in general, very young children are more likely to be hospitalized with respiratory infections than older kids because they can handle their secretions better, but also because we've had kids who have fever in the very first few weeks of life, in which they get hospitalized for evaluation of serious infection as well. Overall, though, the vast majority of children do not require hospitalization after getting diagnosed with COVID infection, and a very small proportion of children actually make it to an ICU, which is very different than adults. So how does this help us, right? This is a lot of data and it's a lot of numbers, but in reality, what it helps us to do is to take a pause and take a breath and think about the fact that, yes, children do get infected with COVID. By and large, they have mild symptoms. When they do have symptoms and they don't need hospitalization, and they generally don't die. There have been some deaths, but it's really a low number across our entire country and actually across the world. So this hopefully helps you to then kind of conceptualize or think about, okay, I have some data now, and I know, or I think I know what my values are. How do I make decisions about school and sports for my children? So there's some things that are important for you to think about and to understand as you kind of traverse through these decisions. So one thing is really understanding the measures that the school district and the school has or is going to implement for either on-site schooling or hybrid models or virtual learning. What things are available? What type of learning will it be? What measures do they have in place for kids who are going to be on site? Will they be distanced? Will they be wearing masks? How are they doing lunch? How are they doing PE? How are they doing recess? All of the things that are important in terms of safety, but also will help, knowledge of those help to make a decision that works best for your family. Similarly with sports teams, you want to know what their policies are. Are kids coming on site wearing masks as they enter the facility? Are they wearing masks while on the sidelines? Are they making sure that everybody has their own water bottle and they're not sharing? Are they keeping parents distanced away from the kids? If parents are allowed to be there and physically watch activities, are they wearing masks? Are they distancing from each other? And what are the rules around that? What does the team or the school or the club have a plan for if there's a positive child, who tests positive for COVID, or a parent who may have had contact with other parents if parents are there? And what will that look like? And so understanding those kinds of things also help to kind of make a decision around activities related to sports teams and other extracurriculars. The other thing that you need to take into consideration is, what is the health of your family? And so we've had a number of people ask us throughout this pandemic, is it safe for my child to see their grandparents, or from grandparents, is it safe for me to see my grandkids? And really that is a personal decision. And the things that need to go into that is, what is your health, or the health of grandma and grandpa? How high risk are they if they were to get COVID infection? What are the things that the family unit is doing to remain safe? Is the family wearing masks in public and avoiding large crowds and doing frequent hand hygiene and social distancing when they are out and about, so that it feels safe when they come into contact with other family members? It's important that we do the things that make us feel safe and that are consistent with our values. I want to stress that it's okay to make a decision either way. It's okay to say, I don't feel safe and I think we need to wait a while, but it's also okay to make the decision, I'm going to see my grandkids and I want to spend some time with them, okay? And just be secure in that, and not look at the judgment of others. This is a very personal decision. My parents live next door to me, so they have been at my house every day almost since this started. And we have a family contract and an agreement of how we conduct ourselves at home, in the community. My kids are expected to follow it. They know that they need to protect my parents. My dad is 76 years old, but it's important to me, my values, that my kids spend time with my parents. And so I think, it's everybody's own decision, and just take into account these things as you're thinking it through. So I wanted to stress, determine what works best for your family here. And then once you've made that decision, feel good about it. Don't let others second guess your decision. So I want to switch gears for just a moment and talk about testing. It's really important, if you or a loved one or even a friend of yours has symptoms of COVID, that they go and they get it and they get tested for a variety of reasons. And I'll kind of enumerate those. One, we want to know if people are positive. It helps in knowing our community rates, our local rates. It helps in knowing our state rates, and it helps in knowing our national rates, which is actually very important from a disease epidemiology perspective. And it helps to know where resources need to go. It also helps to know who does and doesn't need to be isolated at home with infection. So we know that if you have COVID infection, you need to be isolated at home for 10 days and avoid contact with others until you're no longer infectious. For kids, it's important to be tested if they have symptoms, because if they have the opportunity to go to school and the family has chosen the child will have on-site school, the faster they get tested, then either if they have a negative test, they can get back to school, or if they have a positive test, we know they're in home isolation and then they can get back to school in that 10-day time frame. So it really helps keep the community functioning as well. Oftentimes people think that I have mild symptoms. I just had a headache, or I just had a sore throat, and therefore this is allergies. When in reality, it might be COVID. And so if you think it could be, then it's always best to just get it checked out. What we know now about COVID infections too, related to symptoms, is that loss of taste and smell are actually more likely to be COVID than other viral illnesses. So oftentimes when you have a cold, you can't smell or taste anything, and things don't taste that great. And that's probably why people eat a lot of chicken soup, because it's pretty salty and you can actually taste salt when you have a cold. And it does make you feel better too, right? It feels comforting. But in reality, loss of taste or smell has actually been shown to be a really good predictor of having a positive COVID test in relation to the other symptoms. So I wanted to talk for a minute about why I wear a mask. So you may be familiar with this data that was published by the CDC. It was talked a lot about in the media, but this is what happened. There were two hairstylists in Springfield, Missouri, who both came to work sick, as many people do, but they were wearing masks, both these hairstylists, and between the two of them, they cared for 139 people. Did their hair, spent time with them. You know, for some women, you can be at the beauty salon for several hours. So all of the patrons were also wearing masks. So these two women cared for 139 people over a 4-day time frame. Everybody wore a mask, and nobody was infected with COVID from these two women who came to work with symptoms of COVID while they were sick. I think that is such a good example of why it matters and why even just wearing a cloth mask really helps in terms of school, in terms of our community, and in terms of disease transmission. So that's why I wear a mask. So I wanted to turn for a moment about COVID vaccination and also influenza. So we're heading in pretty soon into the fall and then into the winter, where influenza becomes a big player. Every year, in adults, we have somewhere between 30 and 40,000 deaths from influenza, and in children, usually around 100. So it's not an insignificant disease in our country. The good news is we have a vaccine for influenza, and it's recommended that all persons age 6 months and over get it every single year. I know that there's a lot of people out there who don't like shots, and I completely understand that. And there is an option of a nasal spray vaccine as well. But I would dare to say that getting a one shot once a year is far better than ending up in a hospital getting many different pokes and prods related to having influenza infection. While influenza vaccine is not 100% effective, meaning it doesn't always prevent disease, what it does do when you get the vaccine is if you get disease, it prevents hospitalization and it prevents death. And we have really good data to support that. The reason I'm stressing this so much right now in the midst of COVID is because we don't know what this fall and winter is going to look like, and we don't know how much co-circulation there will be with influenza and COVID disease. And if there is a lot of circulation of both at the same time, we could be facing more severe symptoms in patients. We know that in general, when patients are co-infected with more than one virus, they generally are more sick, more likely to be hospitalized, more likely to need ICU care. I also wanted to talk a little bit about a COVID vaccine trial that's going on here in our Kansas City area. We are partnering with KU Medical Center. We have two physicians who are acting as co-principal investigators for this study. It is the AstraZeneca vaccine that we will be studying. We are enrolling 1,200 people across KC and then Wichita and other kind of outlying areas of the state of Kansas. And there'll be enrolled 30,000 people nationwide. The enrollment for this study will be starting in the next couple of weeks. And the idea here is that we are able to enroll people quickly, get both doses of vaccine over a month period of time, and be able to get the data that's needed to support FDA approval of vaccines moving forward. This is all part of an NIH-funded trial network called CoVPN. And this is a national network where different sites are doing different studies of the different for the different vaccine manufacturers. And we have been chosen to be a site for this particular vaccine, and there will potentially be a second vaccine trial later this year for adults. We are also hopeful about having a vaccine trial for children later on this year and into next year. So more to come on that, but it's really an exciting opportunity for us as a community to really come forward and contribute to the development of new knowledge and science and hopefully a vaccine to help prevent disease. So with that, I would like to bring up Dr. Jennifer Watts to talk to you some more about COVID-related school and community issues.
Thank you, and thank you for having all of us here today. It's a real honor to have the opportunity to share with you all some of what we have devoted our lives to. So, I mean, we live and breathe this every single day, but it's an honor to be able to share it with what I call normal people. I'm going to talk to you kind of about how we have worked over COVID and how we continue to work with supporting our Kansas City community. I'll talk a little bit about the COVID trends in our community. I'll discuss how we have helped schools get ready and what our plans are and to continue to help schools. And then I'll talk about our community's readiness for what has been titled the worst fall in recent history. I just want to take a minute to put this into perspective for you. I joke and say that somewhere after the holidays, I really entered this time warp. And I do disasters. I thrive on this. I'm a pediatric emergency medicine physician. So I function really well in chaos. And I mean, I specialize in disaster and emergency preparedness. So it's something that I love, but I tend to do short-term disasters, not something that really lasts 6 months plus. I thought this helped to just kind of map out where we were and where we are today. If you remember, and maybe some of you don't, but back in January was kind of when the WHO, the World Health Organization, really started talking about this pneumonia-related illness in China. And what is this? Now, I do international work too. I work heavily with colleagues in the Philippines, close to China. I actually had trainees in the Philippines at the time when we had this conversation, and I was bringing them back home for other reasons. But I remember even saying, whatever you do, don't fly through China. There's something going on there that's some weird viral respiratory thing. I don't know what it is, but just try to avoid that. They continue to remind me today, yeah, that COVID thing that you told us it wasn't a big deal, but just don't go there. Now it's everywhere. So I say that because I think we were all in that mentality of, this is so far out there. But that was back in January. Since then, we've come a long way. In February, we started seeing some of the global air restrictions with travel. March 7th and March 9th was when we started reporting cases here. March 7th's first case was in Missouri, and that was in St. Louis. And on the Kansas side, our first case was in Johnson County. So that one was a little closer to home in the metro area. Shortly after that, it was declared a pandemic. This is real. This affects us now. And then shortly after that, my kids never went back to school after spring break. and we entered this realm of entire city lockdowns where our whole lives got flipped upside down. And we tossed around things of, what do we do? How do I get dinner fast? I can't just run out and eat. Oh boy, I got to teach myself how to cook again. What do I do with my kids bouncing off the walls while I try to figure out how to work from home? Don't come in this room. I can't have you make noise. That would look bad on me. So we all started dealing with those issues, and that was in March. And in May, 2 months later, we start the reopening phase. From that time, I tried to highlight some of the things that come up in the emergency medicine world. The Lake of the Ozarks picture that went viral, that was kind of a big deal because even my brother out on the East Coast is texting, telling us, hey, you guys made national news. The Black Lives Matter protests began. Those were big issues around emergency preparedness. And then finally, in the end of June, we started talking about some of these masking mandates. So again, this just kind of shows us this is a long time. This is a really long time for something that even I said, yeah, it's out there, it's something, to now where we are and how much we're really dealing with this. When you look at cases over time, we have on the right side is the national data that I titled national. This is data that comes out of the CDC. This is the course since the beginning of all of this to probably a couple days ago when I actually pulled the data. But it's the over time and the number of cases that have shown up each day. And you see you see a peak and then a little bit of a dip and then a peak again just recently and another dip right at the end. When you compare that to the Kansas and the Missouri data, which is again over the same timeline, When you compare that to Kansas and Missouri, we don't really drop at the end yet. We are still dancing up there, kind of in that peak area. So I bring this up that we hear on the national news of schools in this state are opening up, and these rates are this in this state, and all the variation across the country. And I bring this closer to home because our rates are still pretty high around here. And I think we are still a little behind the national curve of where things are. Obviously the big issue right now is schools and how we get them involved and how we open them back and get our kids back in schools. Everything in my disaster training, when a tornado goes through a city, one of the first things that we do is really to get those schools back and open for the elementary kids specifically. They thrive on security. They thrive on knowing that they are safe, knowing that they are secure, knowing that their life is going to be okay and another tornado is not going to come back through. But it gives them some sense of security. In a pandemic that lasts as long as this and continues to last, it's not always that easy. It's not as easy as just reopening the building and bringing everybody back in. I think that, in the public health sector, I think we all want, in the pediatric sector, I think we all want our kids back in school. The question is, how do we do that as safe as possible? The decision on whether or not to open schools and when to open them and when we back off and so forth, that's a decision that's being made by our public health experts. I have my master's in public health, but that's not technically what I don't do epidemiology. I don't do public health on a day-to-day basis at that level. And so we really look to our health departments to really make those decisions and guide those decisions. What we do as Children's Mercy is try to help the schools reopen in a safe manner. If and when they are allowed to reopen, we really can work with them to try to make sure that there are safe practices for kids, for the well-being of all kids, and in all environments. So regionally, I can tell you we've done a lot of work around some of the data, some of the compiling of resources. People always ask me, where do I get my numbers? Where do they come from? I will tell you first and foremost, health departments. Health department data. Now, some health departments have better websites than others. Some are easier to navigate. Everybody's a little different. But in our region, there's a large area. I mean, there's quite a few health departments in our region that have very solid quality websites that have their data publicly on them, sharing that data. The other question I always get is, how does that work? So at Children's Mercy, we see patients from a huge catchment area. They come to us for various reasons, and I may do a COVID swab on, I may do 20 COVID swabs in an evening shift in the emergency department. And that data ultimately, we report that data, absolutely, and that data ultimately gets funneled back to the health departments of where those children live. So I know that when I go to, say, Johnson County's website with the health department and I'm pulling up their numbers, they have the numbers of the kids that I have tested that live in Johnson County. So really the local health departments are probably the best source of data for the most local data that you can get. Regionally, on the it's Mid-America Regional Council on our MARC website, under Prepare Metro KC, you can see that this is the example that I've pulled. The region has really tried to consolidate a lot of this data and make it a little more interactive so you can pull that a little easier. The graphs on the right side of this, you can go down by jurisdiction, click on the areas that you want. You can pull up the state data. You can pull up the different counties. You can compare. You can do whatever you want with the different counties, and it's kind of nice just to see the county that I live in and where that compares to the county that I work in, or the county that maybe my husband decides to go visit for some unknown reason. But just the variation, you can really play with it and see what you need. The other thing that I will say that is on this website that I like is there's a section on these graphs that is titled KC Region School Reopening Plans. if you are not in a certain district, but you want to know what, like, my cousins are doing in another county, I can click on that, and that will pull up the regional schools and what their different reopening plans are. So it's kind of a consolidated place for data and plans. At Children's Mercy specifically, we also have a website. You're more than welcome to visit it as well. And I think you will find a lot of information here too around returning to school and our community safely. Our group of experts from our infectious disease crew, our environment crew, behavior and development, our community benefit, some emergency preparedness people, our sports medicine, a lot of people have put a ton of work and effort into developing resources and guidelines for kids in the community. On our website, you will find how to return to sports safely and some of the recommendations around sports. You will find tips on helping your child how to wear a mask. This is something that they're going to be faced with, the reality. If they leave their house, they will be required to wear a mask. And so you can find tips on how to help them navigate that. The other pieces that are on here, there's a guidebook. It's about 20 pages. It's a guidebook of a lot of information on safe practices in school, different things that schools can do to make their schools a little safer if and when kids return. We have worked with a lot of regional schools, a lot of different districts. We have had experts participating in some of the state level, regional level, multiple different areas and some of the different practices. We've done many consultations just one-on-one with schools to help them really navigate the nuances of their buildings. Every building's a little different and everybody has a different need. So we've really tried to help them feel better about some of those safe practices. It's something that I passed along to the principal at our school, and any school is able to reach out and request a consultation. The other thing that we talk about too is some of the mental health in schools. And we have our behavior and development team participate in a lot of the guidance. But the thing that I will tell you in general as a parent, I have 3 kids, and the reality is the anxiety in our house is palpable. It may be because I bring it home on a daily basis, I'm not gonna lie. But the reality is we're talking about school getting started again. And we have many discussions around what this is gonna look like, what it looks like now, what we're talking about it looking like. And so the anxiety in kids is there too. And I think the most important thing we can do is recognize it, admit it, and have an open dialogue about that with our children. And so there's some resources too on our website about that that may help you navigate those conversations. And finally, I'm going to talk about preparedness. So there's been this idea that maybe we are entering the worst fall ever. I'm not really sure what that means because I don't know that I can even wrap my brain around that. What I do know is that we're coming into viral season because we do that every year in the pediatric world. Our emergency department gets extremely busy and everybody has a runny nose and a cough. And wow, those are very similar symptoms to COVID. So to me, that's what I think we need to really be prepared for. As these respiratory viruses come in, identifying what they are. Is this COVID? Is it flu? Is it RSV? Is it another respiratory virus? Because there's a million of them. But starting to really try to flesh that out. And that's why you have your pediatricians too. That's our job. That's what we do. And so I encourage you to really work with your pediatricians this fall as we enter the viral season. Regionally, we look at things in emergency preparedness around testing, around PPE. Do we have what we need as a region? Do we have enough hospital beds? And I can tell you that there's a lot, there's maybe not a lot. There's more than me that have this idea of disasters are fun and that we enjoy thriving in this environment. And so we really work hard to make sure our community is prepared. We have hospital plans to expand what we call surge, and we have plans to expand our bed capacity if and when that time comes. We have regional plans around that. And we have meetings regularly. So we see the same reports out of New York when that hit, and we started preparing, even before that time. And we're continuing to do that again into the fall to help prevent some of those needs. As far as testing, we're looking at preparing for numerous tests to help kind of flesh out what is what coming fall and winter, and which virus we may see. At Children's Mercy, we have taken the position of standing up quite a few of our drive-up testing sites. We are working with our local pediatricians to really try to get testing support into their practices, and a couple different avenues so we can really supply tests throughout the region through the fall and winter season. And finally, I will say a piece about preparedness when it comes to mental health. I think that now's the time we need to start thinking about it. Yes, our kids are going back to school, but I think that we also know that this isn't going to be a normal school. No matter what we think, and no matter what we want, it's not going to be a normal school in the sense that we understand normal. Things will look different this year. Holiday season will look different. I started thinking about Halloween and if we're going to be able to trick or treat. Things will be different. And I think that now is the time that I would encourage you to really sit down with your family and have some of those conversations. Start preparing yourself for what this may look like, knowing that it could change at any minute, knowing that what I'm doing today could be completely different to what I'm doing tomorrow, but also being open and honest about that with your family and really fleshing that out with the people that you trust the most. I would channel Dr. Bickel's sense of calmness in all things. Take a deep breath. It's going to be okay. We are going to be okay in Kansas City. But I do think that now is the time to start preparing for that. And we have a personal responsibility to our community, to our colleagues, to our family, to our friends, to really start honing in on what's important and making plans for the next few months ahead. And with that, I'll turn it back to Paul Kempinski.
Well, first of all, I want to thank Drs. Bickel, Myers, and Watts for sharing their insights and expertise. We really appreciate them taking the time to join us today. We hope this information was helpful to you as members of the community, as parents. And please know that we at Children's Mercy are committed to continuing to share advice, counsel, data, evidence, and support you as parents and support the community in any way we possibly can. Our vision statement at Children's Mercy is to create a world of well-being for all children. And the work that we are doing to help guide our own employees, our providers, our patients, and the community through this journey is so perfectly aligned with that vision, and we remain very committed to it. I want to thank all of you for joining us today, and I hope this information was helpful to you. And again, know that you can call on us at any time to provide you whatever support is necessary to help you through this journey. And again, as Dr. Watts said, we will get through this, we will be okay, and we will come out better on the other end of COVID-19, and we will stay in this journey together, and we will go through this journey with grace and civility. Thank you again for joining us, and have a wonderful day.